Guys, so this is just a quick guide because hindi ta mo matiis, and I know abnormal psych is pretty challenging. So for the introductory topics, just to give you an overview and to help guide you how you're going to approach studying the other families of disorder. Sige, let's do this, no? Sige. So what is abnormal psychology? What is this in the first place? So it's a scientific study of abnormal behavior undertaken to describe. So we want to be able to describe, predict, explain, and change abnormal patterns of functioning. So that means when we're studying abnormal psychology, we're looking at these 4 goals of psych, which are all very familiar to you because these have been discussed na in Gen Psych pa, diba? So first, we want to be able to describe. What do we mean by that? So when we describe something, that means we want to look at what are the symptoms, the signs and the symptoms we need to see a person experiencing in order for us to say that the person is experiencing or has a particular psychological disorder. Next, we want to be able to predict. So part of this is understanding what is the extent nag-occur ang disorder in the population. Does it occur more in males or females or those with particular histories? So here we are talking about epidemiology, diba? In the sciences, in the medical studies, epidemiology. So we look at, does this happen more sa young adults or sa middle-aged people, or is this more common in males than in females, or if it's particularly common in specific na races or ethnicity, so on and so forth. Okay? And then next is we need to be able to explain. So here we are talking about etiology. What is the origin of the particular disorder? So, of course, here pa lang, right off the bat, I'd like to clarify that for a lot of psychological disorders, we don't have parang one definitive explanation for where that comes from. Usually, it's a combination of a lot of things aggravating the situation. Okay? So, yeah, but that's it. And then, of course, we also want to be able to change abnormal patterns of functioning. So that means we're also going to look at treatments. What are the treatments used by medical and mental health professionals to help improve the conditions of those with psychological disorders? Okay? So, yeah. Sige. Let's go. So here is the topic outline. So for prelims, para patikim again. And so we have a clear understanding of what we're getting into before we look at the specific disorders. We are going to study the introduction and history, but I'm not gonna make a video on the history na. So that's really more just of reading up on the story of abnormal psych. So that's on you na. And then we're going to look at the multidimensional approaches. And this is very important because if we're going to study etiology and treatments, we need to understand what are the different perspectives. Now, if you remember in Gen Psych, we've already explored the different perspectives. Diba? May genetic, may biological, may behavioral, cognitive, psychodynamic, sociocultural, so on, diba? So on. So here we're going to look at that, but specifically in the context of abnormal behaviors. Okay? And then we are going to look at different ways by which we can perform clinical assessment. So actually, you're not gonna do this. This is for psychologists and psychologists in training. But as future psychometricians or as future medical professionals, it would be helpful if you also have an idea of what are the tools and techniques that are useful. And then after that, we are going to jump straight into the schizophrenia spectrum. So in the Philippines, this this family of disorders, one of the most common, perhaps actually even the most highly reported, although baka ma-overtake siya ng mood disorders, particularly depression. But right now, this is it. Okay? And then for midterms, we are going to look at anxiety and stress-related disorders, and then OC, and impulse control disorders and mood disorders, so on and so forth. Okay, so yeah. So what is a psychological disorder? Since this SEM is all about disorders, okay? So when we study a psychological disorder, we say that it is a psychological dysfunction within an individual, and it is associated with distress or impairment in functioning and a response that is not typical or culturally expected. Okay? So, another slightly different but similar din naman ang main idea na definition is that it's a behavioral, psychological, or biological dysfunction. So, we look at what is the person's way of behaving, and we know that it's not functional, meaning it's not adaptive. And we look at the psychological functioning, so meaning yung thought patterns niya, and then the biological also, okay, that are unexpected in their cultural context. So it is different, okay, it's different and associated with present distress and impairment. So distress meaning the person is bothered or the people around him are bothered for him. And there is impairment. So when we say impairment, that means the person cannot perform the things that he or she should be able to perform in that point in his life or possibly in the past, or hindi niya pwede ma-perform in the future, for example. So work, learning, so that can be in the school setting, in the occupational setting, or in family life, or in his or her social life. And of course, there is an increased risk of suffering death and pain or impairment. So this is where danger comes in. So for example, there is a risk na mag-attempt mag-suicide yung person, or if there is a risk that the person may harm other people in his or her home or in other places. Okay? So that's what a psychological disorder is. And if you look at the criteria niya, you can break that down into what we call the 4 Ds. So the first one is deviance. So it's atypical or not culturally expected. Now, that's quite a simple definition, but if you think about it, it can be very tricky to determine because we have norms, and those norms tend to be different depending on the culture. Okay? So there are expected behaviors of you, but they're not necessarily written in paper. You're like, oh, you can do this or you don't do this, etc., etc. So there are certain behaviors. Like for example, if you see somebody always laughing on his own and talking on his own, that's not something that's pretty common na ginagawa ng tao, at least in our setting, no? And it's deviant, it's different, but is it dysfunctional? Is it a problem? Diba? Does it harm the person or other people? Does it cause distress to the person or other people? So medyo kulang. So can it be considered a disorder or not? Right? Diba? So there's that question. Next naman is distress. So again, if the behavior or feelings experienced by the person cause him to feel upset, diba? Or the people around the person are experiencing distress as a result of what the patient is doing or saying, then there is distress. Next is dysfunction. So there is a breakdown in cognitive, emotional, or behavioral functioning. So for example, if every day you keep ending up in places where you shouldn't be. So let's say, for example, you're supposed to be going to school, but then you snap out of something, and then you're there standing outside Lipunan. Okay? Or you're there watching the river. Okay, sa may plaza. So parang, what happened? How did you even get there? Okay, so if you cannot remember how you got there, diba? Or if maybe you were saying things you did not know you were saying, so there is a breakdown in your functioning. Okay, so for example, also if your moods or your emotions, if you keep panicking in your room when there does not seem to be anything worth panicking about, and then you cannot control yourself, so you cannot self-soothe, okay, there might be dysfunction, diba? Okay, or for example, if let's say you have a tendency to scratch your skin, such I know a lot of us like do that from time to time, but there are people who like to do that to the point where they have wounds all over, they have scabs all over, they're bleeding all over. Clearly that is a problem, diba? Okay, so that is dysfunction. And the last, of course, is danger towards self, others, or property. So let's say if you put yourself in harm's way, so let's say for example, you are always drunk, and so when you are, and then you're driving pa from school or from work, so it puts you in danger. Or let's say for example, you think that other people are going to attack your house, and so you're always there locked up in your room, and you have prepared mga knives, and you say that anyone who comes near me in my room, I will stab him or her with my knife. So clearly you are a danger to other people. Okay, so that's also part of the criteria. Okay, so everything clear so far? Yay! Sige, sige. So we have a worksheet, so I'm not gonna go over this. I'm gonna jump straight to the next part.